Hi, my name's Janice Nichols, and today I'm going to be doing the chest, lung, and heart exam on my patient here. Can you tell me your name and your birthday?
Brandon, 12892.
All right, perfect. So first I'm going to start all of my assessment pieces while he is sitting. So the first thing I'm going to do is assess his trachea. And as you can see, it is midline. Then I will find his suprasternal notch, and from there, the angle of Lewis. Then, if you could sit up straight for me, I am assessing his AP diameter versus his lateral diameter. And it is about, his lateral diameter is about 2 times his AP diameter. I'm also looking for, at this point, any rib prominence, which I don't see. I'm also assessing the rhythm of his respirations. So now I'm going to take his radial pulse and count his respirations as I do so. Just breathe normal. Perfect, thank you. Respiratory rate is about 16 breaths per minute, and his rhythm was normal. His chest rise is symmetrical. He's not using any accessory muscles when he breathes. There were no audible sounds from here while he was doing the breathing assessment. So next I'm going to palpate for any crepitus. And he has no crepitus. All right, now I'm going to have him turn around for me. And from here, I'm going to assess thoracic expansion. So go ahead, take a big deep breath. Thank you. And again. Perfect. Breaths are, expansion is symmetrical, and his thoracic cavity expands as expected. Now I'm going to check for tactile fremitus. So I'm going to use the palm of my hand, and I'm going to have you say 99 each time that I move my hand, okay?
Okay.
Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Thank you so much. Now I'm going to percuss. Okay. And then can I have you take a big deep breath in, and then expel all your air, and keep it out. Okay? Okay. One more here. Okay, now I want you to take a big deep breath in and hold it. Okay, go ahead and let it out. So that was a test for diaphragmatic excursion, and it showed that the sound of dullness was found about 2 centimeters apart between expelling all of his air and taking a big deep breath in. With percussion, I noted resonance over all lung fields, no hyperresonance, and only dullness when we passed from lung to organ. All right, now I am going to auscultate all of his lung fields. Go ahead ahead and take a big deep breath for me. Okay, perfect. Lungs are clear, there's no adventitious breath sounds. And now I'm going to do the same thing, but I am going to have you say the letter E whenever I move my stethoscope, okay? So this is a vocal resonance test, the egophony test. I'm listening for the sound of A instead of E over his lung fields. Now I could test with the bronchophony test, or I could test with the whisper, I think it's pectorophony test, where he whispers instead, but we're going to go with the egophony. Okay, the letter E, please.
E, 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 E.
Okay, perfect. All right, and among all lung fields, heard the letter E. I'm going to have you turn around. And now I'm going to test him anteriorly. So I'm going to auscultate all lung fields on the anterior portion of his chest. Big deep breath. Okay, perfect. And we're going to go ahead and do the egophony test again as well. Go ahead and say the letter E for me.
E, 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 E.
Okay, perfect. All right, and while he is sitting, I'm going to start the heart portion of the exam. So I am going to feel for sternal border and his sternum, and apical impulse. Then I'm going to listen to all of his heart sounds and listen for the S1, S2, any splitting of those, the S3 and S4 extra heart sounds, and any murmurs. Beginning with aortic, just breathe normal. Pulmonic, Erb's point, tricuspid, and mitral. Heart rate and rhythm are regular. There's no extra sounds, no splitting, no murmurs, and S3 and S4 cannot be heard at this point. So now I'm going to move to the supine part of the exam. So I'm going to have him lay down, and I'm going to adjust my camera. So at this point, I'm inspecting his precordium for any pulsations, heaves, or lifts. I would use tangential lighting in the office with his shirt off. And I am going to palpate as well. No pulsations, no heaves, no lifts. And then I am going to palpate for apical impulse and thrill. And then I'm also going to, I'm going to auscultate for apical impulse as well. Okay. And then finally, I'm going to have you rise up on your left side for me. And again, I am going to auscultate for apical impulse. All right. No adventitious sounds heard. Again, no murmurs, no gallops, no rubs, no thrills, no pulsations felt when I palpated. So that concludes the chest, heart, and lung portion of my exam. You can go ahead and sit up. All right. Thank you very much.